Alrighty, good afternoon, everyone. Thank you for joining us for managing side effects of prostate cancer today. For those of you new to the Cancer Wellness Center, I would like to take a minute to tell you more about the center and the services that we offer. The Cancer Wellness Center is a nonprofit organization aimed to improve the emotional and physical well-being of those impacted by cancer and their families. Our services, which are both virtual and in person, include education programs like the one today, that are developed to help you navigate the varied challenges that come with living with a cancer diagnosis. Wellness classes like yoga, meditation, stress relief, and more that provide a healthy approach to living. And support services, including counseling and support groups that are designed to help patients, their loved ones, and those bereaved manage the mental and emotional impact of cancer. If you would like to learn more about the center and connect to our free programs and services, please visit cancerwellness.org. And the link will be included in the chat. As I mentioned, this program is being recorded today, so your audio is disabled. If you have questions, please include them in the chat box. Now, without further ado, I would like to welcome our partner here, Jennifer Wardove from City of Hope.
Thank you so much, Savina, for having us today. As she mentioned, my name is Jenny Waldorf. I am the marketing manager for City of Hope Chicago, formerly known as Cancer Treatment Centers of America Chicago. And we're excited to share, last week marked the 1-year anniversary of City of Hope joining forces with Cancer Treatment Centers of America, CTCA, which really united our shared vision, values, and commitment to providing high quality, compassionate care that puts patients first, an integrative model all under one roof. I know Tracy Thomas, our presenter, is gonna touch on that a little bit more, but I did wanna share that last week also marked another very important milestone in expanding patient access to that personalized leading edge cancer care, which is the name change of all CTCA locations to City of Hope. So today, we are not just part of City of Hope, we are City of Hope. Our Illinois location in northeastern Lake County, so about 35-40 minutes just north of the Cancer Wellness Center, is now called City of Hope Chicago. And our 2 outpatient care centers are City of Hope Outpatient Care Center downtown Chicago and City of Hope Outpatient Care Center Gurnee. So we're very excited to be united into one of the nation's top cancer research, top and largest cancer research and treatment organizations, with those opportunities to broaden access to leading edge cancer care and that specialized expertise. And we look forward to continuing our partnership with incredible local organizations like Cancer Wellness Center, who are doing such amazing work in the lives of patients, survivors, caregivers, and their families. So thank you for inviting City of Hope Chicago to be with you today. And I'm pleased, very excited to introduce Tracy Thomas. She is a naturopathic provider at City of Hope Chicago, where she uses evidence-informed strategies to help patients reduce side effects, support their immune health, and improve their quality of life. She works with patients with any cancer diagnosis, employing natural remedies, nutritional supplements, and botanicals. She first joined us in 2008 and came back to us last year. We're so excited to have her back with us. And during her tenure then, she served as naturopathic residency manager and a member of the genitourinary Cancer of Excellence team. She has extensive experience in helping cancer patients manage their symptoms. Just a little bit about Tracy. After obtaining her Bachelor of Science in Kinesiology from Indiana University in Bloomington, Indiana, she went on to earn her doctorate in naturopathic medicine. And she is also a fellow of the American Board of Naturopathic Oncology. Outside of City of Hope, she loves to travel and spend as much time in nature, awesome, with her dog and her family. And she is here with us today to share her expertise on evidence-based natural therapies to help reduce the severity and frequency of common side effects of prostate cancer treatment, including hot flashes, fatigue, joint pains, weight gain, erectile dysfunction, and mood changes. She'll also be introducing naturopathic medicine and how to use supplements safely to support immune health. So please join me in welcoming Tracy Thomas. Tracy, over to you. Thank you for being here with us today.
Thank you, and thank you, Savina and the Cancer Wellness Center, as well as Jennifer, for introducing me. I'm looking forward to talking with you all about natural medicines, nutrition, and nutritional supplements that can help support those with a diagnosis of cancer, and specifically the side effects of prostate cancer treatments today. So one of the things I enjoy most about the work that I do in supporting patients with a diagnosis of cancer is I get to offer evidence-based natural therapies that you all have questions about. How many of you have questions of what should I be eating? What supplements should I be taking? How much, what's the dose? And what can you take safely that's not going to interfere with treatment? So what's unique here about our team at City of Hope, formerly Cancer Treatment Centers of America, is all of your medical oncology team, we all work together and offer the best of personalized medicine. So we pull all the pieces of the puzzle together to offer you the most evidence-based therapies that are going to help support your quality of life, get you through treatment, and then have you thrive in survivorship by boosting your own immune system so your body continues to fight. I am going to share my screen here with the presentation. There we go. And let me see how I can advance the slides. Oh, there we go. Okay, got it. Thank you I appreciate your patience with technical difficulties here. So today, as I mentioned, we're going to discuss what are the nutrition supplement recommendations, some lifestyle recommendations to help you through the treatments of cancer and prostate cancer. So the treatments for prostate cancer, one of them is active surveillance, which means monitoring you. Your oncology care team will monitor you through blood work, through specialized testing, as well as diagnostics to determine if and when there's a need to initiate treatment. So active surveillance is appropriate for certain types of prostate cancer and certain gentlemen who are at low risk. And this is a great time to utilize natural medicines. While the conventional team is keeping a very close eye on you, we can use natural medicines that have evidence to support your own immune system health. And so your body is continuing to fight while you're under active surveillance and trying to delay the need to initiate treatment. We have surgery, which we're going to get into a post-operative and wound healing protocol. Radiation is an option, and we want to look at what supplements and natural therapies can we use to protect the healthy tissues and cells from the side effects of radiation. Androgen deprivation therapy is a type of therapy that blocks your male sex hormones, because male sex hormones are a fuel source. They are what actually helps prostate cancer cells grow. So if you deprive your body of the male sex hormones with an androgen deprivation therapy, it's a treatment to help control the cancer. And there is also chemotherapy, targeted therapy, and immunotherapies, which all come with their own set of side effects. So depending on what the treatment option is, you always want to personalize the natural medicine plan, the nutrition, the supplements based on the treatments, because they're different and they come with different side effects. When we look at surgery for prostate cancer, the removal of the prostate, the goals with the natural medicines are to aid in the healing process after surgery. So we want to look at what can we do to enhance your own wound healing? What can we use that's going to reduce inflammation? And what supplements or remedies do we have in order to help support your own body's connective tissue healing, your blood vessels from healing, and what's going to help reduce pain as well? The one thing you want to consider from a lifestyle standpoint after surgery and before surgery as well is making sure you have adequate protein in your meals. Protein and adequate protein, which can be based on your weight, or I tend to look at getting 60 to 80 grams of protein in a day from food sources in order for your cells to have the fuel and energy they need to help heal post-operatively. And when you're looking at protein sources, you want to choose anti-inflammatory protein sources. Things like chicken, fish, turkey. With red meat, you want to limit that to once or twice a week because it is more inflammatory. And then there's plant-based protein sources, including nuts and seeds. You get protein from beans and legumes. Grains such as quinoa has a protein source. You could even consider doing a plant-based protein shake, which is typically sourced from PEA. You just want to make sure that doesn't have too much sugar in it. Now, if you have a history of high blood sugar or diabetes, or you're a smoker, that certainly the high blood sugars and smoking is going to inhibit your own body from healing after surgery. So certainly quitting smoking and then making sure you're monitoring your sugar intake, and specifically from processed sugars like desserts and sweets and candies and sodas, as they will inhibit your body from healing. What are the top natural supplements we look at when we're trying to help our own body heal after surgery? You can consider an omega-3 fatty acids. These are the essential fats that have a very high anti-inflammatory activity, and that's how they can reduce and dampen inflammation after surgery so you can heal. There's a homeopathic remedy called arnica, which has been studied in order to reduce pain and swelling after surgery. That would be something you could take for about a week after surgery to reduce that pain and swelling. There's an extract of pineapple called bromelain, also has very high anti-inflammatory activity. And then you always want to consider your vitamins of vitamin A, C, and zinc, because they have been shown to help blood vessels and connective tissue and aid in wound healing as well. We're going to dive into some of the research here. The old rule of thought is that omega-3s and essential fatty acids are going to impact bleeding and platelet aggregation. And what the new studies have shown is that there's no impact of the omega-3 supplementation on bleeding. And that was even at very high doses, which is 10 grams of EPA and DHA, which are 2 of our omega-3s per week. So you can safely take these things and not impact bleeding or thinning of the blood after surgery. Now, nutritional supplements, you do want to avoid taking them for 5 days prior to the surgery, because you don't want to have anything that could potentially interfere with the cells or the surgical process. So always good to, number one, stop all supplements and vitamins, nutritional supplements, at least 5 days before your surgery. And then anything that you want to take after surgery should always be reviewed with your surgical team, your medical oncology team, or a naturopathic doctor in order to make sure it's safe and you'll know how and when to initiate it. And it's going to meet your goals of whether it's reducing pain, swelling, or inflammation. This was another study that was on patients that were having spinal surgery. And what they actually found was that the blood loss was higher in the group of individuals after surgery that did not take omega-3s prior to, and that there were no complications in the group that were actually taking the omega-3s. So just studies showing the benefit of taking an essential fatty acid. Here's your remedy of homeopathic arnica. Arnica is one of my favorite remedies to use because there's no risk of it interfering with other medications and any other treatments. It's very inexpensive. It's very easy to take, and you take it for a week after surgery. And it's a way to stimulate your own body's healing process in that like curing, like philosophy of an energetic medicine to trigger your body to go do the work that it innately already knows how to do. There's plenty of research in regards to using arnica, the homeopathic remedy, safely. There's studies with breast cancer patients. There was actually a study that combined looking at many benefits and also combining it with another remedy called ledum. And there was an accelerated healing process in over 51% of the population that took the arnica. And the greatest benefit was 3 to 5 days after the surgery and taking it for that week after surgery. Melatonin, which many of you may have heard of. People will use melatonin in low doses to help support sleep and jet lag and help reset our circadian rhythm. And melatonin also has other benefits in that it can safely help reduce pain in acute and chronic conditions. And that was based on 19 different studies that were looked at in 2017. Bromelain, the extract of pineapple, is a naturally occurring proteolytic enzymes. And the benefits of proteolytic enzymes is they are the powerful anti-inflammatories, and they're best taken, they have more anti-inflammatory activity when you take them in between meals or on an empty stomach. So this can be used safely in a supplement form, in a capsule form, post-operatively to reduce swelling and pain via its anti-inflammatory activity. There's also other individuals may use it with chronic conditions of joint pains, osteoarthritis. And bromelain, as the extract of pineapple, is similar to an enzyme in papaya. However, the research is much better and higher with bromelain, which is why I would consider something like that from a proteolytic enzyme. You'll also see bromelain in combination products, and the reason we put things in supplements is because we can concentrate them to get them to a therapeutic dose where they have these healing properties. Certainly eating pineapple would be beneficial. However, you'd have to eat a lot of pineapple in order to get that anti-inflammatory activity. Here's the research studies with bromelain showing that it reduced post-operative swelling, pain, bruising. It was also shown to have significant reduction in inflammation compared to a placebo group, a group that didn't take any bromelain supplements. I like to bring up these evidence, and you can look at these studies individually. I think it's important to note you always want to take a supplement, consider a food when it's been shown to be effective and shown to be safe. Here's your vitamins, a vitamin A, C, and zinc, very important for wound healing, blood vessels to heal, connective tissues healing, collagen formation. And these you do want to take individually in addition to a multivitamin, because that's when you can get those therapeutic doses. And I would say taking them at higher, more frequent doses for anywhere from 4 to 6 weeks after surgery is where you're going to gain the biggest benefit. You don't need to take them at those high doses for long-term use for many months at a time. They also are helpful during cold and flu season to help boost your own immune system. So you get multiple benefits, not only to aid in healing, but also you're boosting your immune system and helping it protect from colds and flus and viruses, which certainly you don't want to come down with while you're healing from surgery. Here's again a chart that lists the clinical studies with vitamin C, vitamin E, and vitamin A as well. Moving into androgen deprivation therapy. Some will call this a hormonal therapy or an anti-hormonal therapy. And to remind you, prostate cancer cells fuel and grow on testosterone. So if you have a therapy that deprives your body or blocks testosterone, then that's how you're effectively treating the prostate cancer. You're preventing it from growing and becoming more progressed. The unfortunate challenge is you learn very quickly the power of hormones. And when you deprive your body of your primary androgen, testosterone, a lot of changes can occur. They can be anything from more fatigue, you can experience hot flashes or night sweats, which can be instrumental to impact your quality of life and your sleep. Body composition changes in weight gain in areas that you normally wouldn't gain weight in the breast area and upper chest. Can be bone loss and a loss of bone density, so ultimately leading to osteoporosis or osteopenia, which puts you at risk for fractures. So these are some of the common side effects of the androgen deprivation therapy that we want to consider. What are the lifestyle strategies that we can use in order to help reduce the severity and the frequency of the side effects? So lifestyle modifications, consider wearing layers so that if you need to, you take off a sweater or take off your jacket. Exercise and certainly warm temperatures and heat can trigger a hot flash. So making sure if you're going to exercise, maybe do it inside at a cool gym. Sometimes difficult conversations or stressful conversations can trigger a hot flash as well. And one of the things you can consider from a food source that has multiple benefits is eating ground flax seeds, 1 tablespoon twice a day. And soy foods have been shown to lower the frequency and that severity of the hot flashes and night sweats. Things that are going to trigger them are red wine, alcohol, hot beverages, spicy foods. Everyone has individual triggers. It may be caffeine. So you want to make sure you're limiting or avoiding those foods or beverages if they are triggering a hot flash for you. And then you always want to be mindful of sugar intake. And when I talk about sugar, I'm focusing on the processed sugars from sweets and desserts and unhealthy foods and refined carbohydrates. Get your sugar through foods like colorful fruits and berries that are naturally sweet. And you also get nice flavonoid content of having a nice low sugar fruit source in any type of berry. Phytoestrogens. So these are plant-based foods or plants that have estrogen-like activity. And specifically, soy foods, flax, and sesame seeds have been shown to reduce prostate cancer risk. So it's important to think about how these things work and when they reduce the risk. They also have been shown to be helpful in reducing the severity and frequency of those hot flashes and the intensity. When you think about these soy foods and flax and sesame seeds, they are things that should be incorporated early on in life and should be part of our daily routine. You know, adding ground flax seeds to a cereal or in a smoothie or to top off some yogurt or even as a topper on a salad. They have a slightly nutty flavor. So things start to incorporate into your daily regimen as far as your meals. Same with the sesame and same with the soy foods as well. Eating tofu or edamame has been shown to be beneficial. They're inhibiting the enzyme that helps to lower the testosterone and act as a testosterone blocker. So it's not as effective as a medication. The foods and supplements that we talk about, they're never as powerful as the medications. The goal is to help support the therapies so you're tolerating them with the least amount of side effects and supporting your healthy cells. Nutritional supplements or nutraceuticals for hot flashes, black cohosh, which is an herbal medicine that can be used, magnesium. And magnesium was found if you dose it twice a day to be a little more effective at taking the edge off those hot flashes. A Swedish bee pollen has a tremendous amount of evidence, and this was studied in a breast cancer population, but certainly was effective at 70% of the breast cancer patients in the study reported an improvement in hot flashes. That's pretty astounding when we don't have a medication that has been shown to be as effective. Hesperidin is a flavonoid. This is what you find in the white pectin of unripe citrus fruits. And hesperidin tends to work a little bit better when you combine it with another bioflavonoid such as vitamin C. There's a homeopathic remedy called cycles, which are little tabs you can pop underneath your tongue, either at the time of having a hot flash, or you can do it 3-4 times a day. I like to keep this one by the bedside if you're waking up frequently with night sweats, as it's a nice quick relief that you can pop underneath your tongue while you're actually having the hot flash or night sweat. And vitamin E, you always want to use a mixed tocopherol, which is a mixed form of the vitamin E's. This one, I would say, probably has the mildest effect on supporting hot flashes. And while we're on this page of nutraceuticals, I do want to make a note that not all supplements are appropriate for all individuals, that you always want to do a thorough review with your oncology team, with a naturopathic doctor, in order to determine, are these things safe with other health conditions? Are they going to interfere with any of your medications? And really, what's the most personalized, individualized plan that's going to be effective to meet your goals and your needs? Acupuncture is a excellent therapy to reduce the severity of hot flashes, night sweats. It also can be effective at reducing joint pains. It's a nice therapy that can be relaxing. There's a number of studies that it helps with chemotherapy side effects as well. So lots of good reasons to consider acupuncture and finding a good acupuncturist that you can see quite frequently, you know, once a week or once every couple weeks, in order to help you manage the symptoms that you're having due to your treatments for your cancer. Hormone treatment and bone health. I mentioned earlier that the androgen deprivation therapies can put you at risk for loss of the bone mineral density. And so you want to make sure that in addition to the medications from your oncologist, you want to make sure you're taking adequate vitamin D3, which helps maintain bone health. It's also good for your immune system. And you want to ask your oncology team, they can test your vitamin D3 level in your blood. And you want to get within the range and also at the optimal functional value of a vitamin D level in your blood, which is about 50 to 70. That's where it's been shown to support and enhance your immune system health. That's where it's been shown to help protect your bone health, and also is good for mood support. When you take a vitamin D3 supplement and you determine the dose based on your individual level in your blood, it's helpful to take it with foods that have a very small amount of vitamin K in it, or a supplement that has a microgram dose of vitamin K in it as well. The vitamin K helps the absorption of your vitamin D3. Taking it with a meal, with a fat, helps the absorption as well. And vitamin K has also been helpful in order to support the bone health. Calcium, if you're going to take a calcium, you want to make sure it's in the form of citrate. That's the most absorbable form, and determine the appropriate dose based on what calcium-rich foods you're also getting. In order to prevent the weight gain, and specifically metabolic syndrome, which can come up from androgen deprivation therapy, you want to make sure you're maintaining your lean muscle mass, doing strengthening type of physical activities, as long as those are safe and appropriate for you. Weight-bearing exercises are helpful, so walking, running, working with a physical trainer who can individualize a plan for you to make sure you're getting adequate strength to maintain that muscle mass. With the food choices, you really want to make sure you're following a low sugar, low glycemic meal plan, which when you look down at your plate, what you want to see is a good, healthy, lean, anti-inflammatory protein source, the chicken, the fish, the turkey. Then on the largest part of your plate, kind of filling half of your plate, you want those cruciferous and brassica veggies. That's your spinach, your kale, broccoli, cauliflower, Brussels sprouts. Those foods, those brassicas and cruciferous vegetables, actually contain an ingredient that's been shown to help support your own pathways and is very helpful at keeping the sugars down when you're balancing the meal with an appropriate size of those foods. A small serving of carbohydrates, that's your breads, your starches, your potatoes, your carbohydrates there. And then make sure you have healthy fats, including either topping it off with some nuts, having olive oil, if you enjoy olives, eating olives, those good healthy fats. And if you notice, the things I didn't mention on the plate are sweets, processed sugars, desserts. And what I find most commonly in our culture is it's the ratio of these foods that's disrupted, in that the biggest serving on our plate is our carbohydrates and starches, and the smallest serving on our plates is our veggies, healthy fats, and a small serving of protein. So think about shifting those ratios. We also have nutraceuticals that can be helpful in maintaining lean muscle mass. One is L-carnitine, which is also helpful for energy metabolism. So if you're more fatigued, you're more tired, L-carnitine can be helpful to help boost energy and as well as muscle mass. And then you always want to make sure you're maintaining adequate hydration and electrolyte balance. Here's some other supplements to consider if you're struggling with, you want to determine where the weight is not being managed very well from a perspective of, if you're gaining weight, is it because you're having unhealthy food choices? Is it because your appetite is very strong? Is it because you're having cravings for those unhealthy foods that you shouldn't be eating or limiting? So we look at the different supplements and how they've been shown to be effective. And when we're looking at appetite, cravings, and metabolism, some of the things I consider are magnolia bark, 5-hydroxytryptophan, 5-HTP. Saffron has some good research, which is a spice and an herb, and also used as a saffron rice. Green tea, and drinking green herbal tea, as well as taking a green tea supplement, has been shown to be a powerful antioxidant, as well as helpful for energy metabolism, can help with cravings and reducing your appetite. Probiotics you want to consider because you want to have a good, healthy microbiome. You want to have a good, healthy GI tract, because that's going to impact not only our weight gain, but also our cravings for certain foods. If you're thinking about what you can use as fillers, you can use anything from ground flax seeds. I would say eating a large serving of those cruciferous and brassicas, the veggies, and making sure that you're cooking them, steaming them, sauteing them, because they are very bulky. So you want them to move through the system, but you want them to fill you up. And also psyllium has been used in a supplement as well, which is a fiber source that can help increase making you feel more hungry, or sorry, making you feel more full. And then monitoring good blood sugar control, good blood sugar balance is about not only following a low sugar, low glycemic diet, but it's also improving your sensitivity to insulin, which can impact our metabolism. So supplements including berberine, alpha lipoic acid, cinnamon, not only using it in cooking as a spice, but also consuming it in a concentrated supplement. And chromium has been shown to help stabilize blood sugars as well. You may or may not have heard of intermittent fasting, time-restricted eating, trying to extend your overnight fast as a way to help control your metabolism and improve your healthy weight management. So this is something that would require a consultation with either a dietitian or a naturopathic doctor, so that you do it safely and don't put yourself at risk for being lightheaded, being more fatigued. And you want to make sure you get the appropriate ratio of nutrients in an eating window that's going to safely allow you to have the energy you need and stabilize your blood sugar and be able to continue work and daily activity safely without having side effects of lightheaded or dizzy or falling. Radiation treatments. The goal that with radiation with prostate cancer is we want to protect the healthy and surrounding tissues through the radiation, and then we have things to help them heal after the radiation is complete. Another note I want to mention is that there are contraindications with radiation therapy, and that is you avoid high dose antioxidant supplements during the entire radiation period. That includes things like vitamin A, vitamin C, vitamin E, zinc. So it's important, again, you want to make sure you are consulting your oncology team to make sure everything you're taking is safe and it's not going to interfere with the treatment. It's going to be supportive to the treatment. When we look at the radiation, it can cause irritation, inflammation through the digestive tract. And we have an amino acid that comes in a powder called L-glutamine that's been shown to help protect those cells that are starting in the mouth all the way through the entire digestive tract. It also can be helpful if you're experiencing diarrhea secondary to the radiation treatment itself. Back to the probiotics we mentioned earlier, really important to get these probiotics to have a good healthy microbiome so your GI, your digestive tract, can do the work that it needs to do. You can consider probiotics in food sources, so your yogurts, kombucha, those have a good source. A Greek yogurt has a great source of probiotics that naturally will help your own microbiome. During radiation, your radiation oncologist may consider having you follow, or a dietitian may recommend a low fiber diet. as you don't want to impact the treatment of the radiation. You want to keep the field where it should be without increasing gas or bloating in the digestive tract. My recommendation is be consistent. So you don't want to add too many vegetables. You don't want to take too many away. Be consistent to what your traditional routine is through the radiation treatment. We have other things to consider if there's irritation to the bladder, and cranberry, which you may have heard of, that's often used for urinary tract infections. Cranberry can also be helpful if you're urinating frequently, if you're waking several times at night to urinate, if you're having any pain with urination. It's a nice, safe extract to use if you're experiencing anything impacting the urinary system or the bladder. Saw palmetto also has trials, and one specific trial that showed a reduction in symptoms during prostate radiation when it was taken for 22 weeks. We here at City of Hope, with our integrative therapies, would always consider a referral to our physical therapy, our rehabilitation program, in order to help train an individual or work in controlling the muscles in the pelvic and going on what we call a pelvic control program. This would be similar to think about physical therapy after you have a knee surgery. You meet with a physical therapist in order to retrain the muscles around the knee and how to walk again and get to a point of running. So you want to think about the muscles in your pelvis. We have a pelvic control program that can be very helpful for the urinary frequency, urgency, and incontinence. Chemotherapy, targeted therapies, immunotherapies, some of the most common things I hear, number one, being more tired, more fatigue. Those treatments drain your cells of the fuel that they need, so you can become more tired, especially with the more treatments you receive. Reduced appetite, which can be due to experiencing mouth sores, nausea, or vomiting. So these are all things we want to address so that your quality of life is maintained, you're able to continue eating and maintain your nourishment through the treatments. One of the things that can come up is a reduction in your blood counts, and specifically your white blood cells. We call this neutropenia. So for many years, there was longstanding advice to avoid raw fruits and vegetables if you're neutropenic. The more recent studies have shown that you can still eat your fresh fruits and veggies when your white blood cell count is low and during active treatment. What you want to do is you want to make sure you're washing them very well. You're making sure that you're not eating or they're not exposed or near any raw meat or poultry in the fridge. If you're cooking the veggies, make sure you cook them thoroughly. If your doubt as to whether the food is safe or if there's any potential bacteria on it, just please throw it out. It's always better to say, if you're unsure, don't eat it and just throw it out. Mouth sores and throat irritation with chemotherapy. The glutamine powder that I mentioned earlier, you can swish and swallow with it. I like to use a medical grade honey or even a local honey in order to reduce the soreness in the mouth. It can act as a coating, soothing properties. Chamomile tea or sucking on ice cubes, avoiding acidic foods or spicy foods that can be more irritating. If possible, they also make honey lozenges. And if you're also experiencing more dry mouth along with the mouth sores, biotin makes a mouth rinse, a toothpaste, a wash, all things to consider, and try different therapies to see what's going to be most effective for you and give you the relief that you need, so that if you reduce the mouth sores and irritation, you are able to keep eating. Nausea and vomiting is a common side effect from certain types of chemotherapies. Very small, frequent meals is appropriate. Sipping on ginger herbal tea with honey or a ginger hard candy. Peppermints, they have anti-nausea inhalers that you can consider. Of course, your oncology team is going to offer anti-nausea medications. Acupuncture, wearing C-bands, which work a acupressure point, and C-bands are used by travelers who experience motion sickness. Different types of aromatherapies. So lots of different options for you if you are experiencing nausea or vomiting. One other thing that's not on the slide too is Sometimes the sight and smell of food can be irritating to people and trigger that nausea. We have homeopathic remedies for that. Sometimes a large portion of food, that's why we recommend very small, become a little bit more of a grazer and eat smaller, more frequent meals throughout the day. If you have a reduction in appetite, you want to make sure you're eating very calorie dense. You want to get a big bang for your buck in the small amount of food that you're eating. So this brings me back to those healthy fats, any type of nuts, seeds, nut butters. Avocados are a great healthy fat. So if you enjoy guacamole, getting that protein source in, using olive oil on your meals. And if necessary, you can consider that plant-based protein powder or a nutritional meal replacement from a dietitian. Fatigue, let's make sure, this is going to sound counterintuitive when someone tells me I'm so tired, I don't feel like exercising. That's actually exercise, maintaining physical activity, even if it's a short, gentle walk for 5-10 minutes each day outdoors in nature, can actually help support your own energy metabolism. Make sure you're getting adequate sleep, going to bed at a reasonable time, aiming for around 7 hours of sleep through the night. Considering supplements, the L-carnitine we talked about earlier, a good quality B complex to support your own energy production, and coenzyme Q10, which can be helpful not only for fatigue and boosting energy, but also it's helpful for your heart health. When we think, now that we've gone through the treatments, what can we do from a prevention and an active surveillance individual? Conventionally, there's plenty of research for anti-inflammatories. And then we have natural anti-inflammatory agents. We touched on the bromelain earlier. You can consider things like turmeric or curcumin. They have very powerful anti-inflammatory activities as well. Pomegranate, and either eating pomegranate seeds or pomegranate juice has been shown to help during active surveillance at delaying the PSA doubling time, so it can keep men under active surveillance in surveillance period longer, delaying that time to treat. Green tea, drinking the green herbal tea, I would recommend anywhere from at least 4 tea bags per day, and you can use 2 tea bags per cup, so really 2 cups of tea that's concentrated with 2 tea bags of green tea. Lycopene, which is found in tomatoes and tomato sauce, is a flavonoid that can also help as far as getting the nutrition you need through your food sources in addition to taking the supplements. Sulforaphane is that ingredient in the brassicas and the cruciferous, all that spinach and broccoli and kale and cauliflower that I mentioned, eating it because those foods are rich in sulforaphane, which help your own body and your own immune system. They've also been shown to help support hormone metabolism. So that's why that ingredient's important. Dean Ornish came up with a diet that was high plant-based. What I would recommend is a personalized diet that certainly is high in plant-based foods, as well as thinking about a Mediterranean lifestyle, which is those lean anti-inflammatory proteins, the good veggies, the healthy fats, and small servings of starches and carbs. There was a 1-year prostate cancer lifestyle trial that focused on a low-fat, plant-based diet, and this was appropriate for men under active surveillance. It delayed the need for treatment by an average of 2 years, and Dr. Ornish believes that this was due to the soy protein in this meal plan, because they were replacing their protein sources and animal protein sources with plant-based or a soy protein source. That was what was shown to have the biggest data from an anti-cancer benefit. Making sure you're maintaining exercise, mindfulness, stress reduction, adequate sleep. We've touched on all of those. Here's for chemo prevention, that active surveillance, the NSAID study. This is an anti-inflammatory. Here's the study that talked about the pomegranate delaying the PSA doubling time. And the reason we look at these foods of soy-based foods or the green tea, the reason they were shown to have a reduction of risk is you find in populations where men are consuming these foods on a daily, regular basis throughout their lifestyle, In China, for example, they have a much lower risk of men developing prostate cancer. And they believe that is because they drink green tea and they eat soy-based foods early on in life and throughout their life. There are also studies that show that green tea, it's the catechin content in the green tea, was shown to prevent a high-grade prostate cancer. It was not as effective for the low grade. And lycopene, we talked about what we get from tomatoes. It's because of that carotene content in there. The sulforaphane had a delayed doubling time of 86% longer compared to a placebo in men after they had surgical removal of their prostate. There's a study if you're interested to look into that. And there's your whirlwind tour. I have mentioned throughout the presentation that it is important to have a guide that has studied, does know the risk of interaction with the supplements and food and how it can help you personalize not only your lifestyle plan, what you're eating, and a nutraceutical plan that's going to meet your needs and be based on your cellular makeup and help you achieve your goals with whatever that may be through treatment and survivorship. So here's the website to find a naturopathic doctor that has additional certification in working with cancer patients and oncology. And then the second one is a group through the Society for Integrative Oncology. And thank you very much. So I'm here to answer your questions, and thank you for joining today. I really appreciate it. Thank you, Cancer Wellness Center.